Hello, my name is Kathleen Listen. I am a lymphatic massage therapist and I help people recover after breast implant illness. And this is going to be my review of the Strategic Holistic Accelerated Recovery Program, or SHARP. And this is the book by Dr. Whitfield, based in Austin. So I am going to talk about this book from the perspective of how it's useful for other lymphatic massage therapists who are helping people after breast implant illness, specifically to help us as therapists understand what our clients are talking about when they're talking about how they are trying to detox, they are trying to use supplements, they are trying to lower their level of toxin exposure. So I like this book because Dr. Whitfield actually has his hands in the game. He does the breast implant illness surgery to remove the implants. He works out of Austin, Texas. And I like how he talks about his previous education in the burn unit. And this is actually where I've seen a number of surgeons who are kind of pro lymphatic massage therapists as part of their patient's recovery. If you ask a few questions, invariably you may find that the person was first exposed to the power of using the lymphatic system when they did their rotation in the burn unit as part of their medical education. Okay, so specifically the book. Dr. Whitfield talks about his theory is that recovery starts at a genetic level. This is why some people are recovering faster than other people. And the important role of chronic inflammation. So if there's chronic inflammation in the patient, that will affect their recovery. And so he wants his patients to have a lower baseline of inflammation before they have surgery. And in some of his research that he looks at, he is monitoring the progress through heart rate variability, which is one great way to monitor the progress of someone. So if they're doing things that should be lowering their stress, you will see it in the improved heart rate variability in the heart, and that's something easy that you can monitor. And he wants his patients to be in a parasympathetic state before surgery. So interestingly, I have seen this in a lot of literature, recommendations for this, recommendations for massage before surgery, but it hasn't really broken out into the mainstream yet. People are saying, and we can all agree, anxiety is normal before surgery, but that doesn't mean you don't do anything about it. If you can arrive as the patient in as parasympathetic state as you can, as relaxed as you can before surgery, if after surgery you can keep relaxed, lower the stress level, lower the inflammation, that's going to give your body a better chance to heal. So this is a great resource for lymphatic massage therapists looking for context about what their patients are saying about detoxing before breast implant illness surgery, about detoxing in general. Because it says on the back, he talks about genetic profiling, how it can guide his patient's recovery, how to combat environmental toxins that hinder the healing. He talks about dietary strategies to support faster recovery and optimal health. He talks about the connection between gut health and immune function, and he talks about how hormonal balance impacts recovery and well-being. So if you're looking at these things on your client's health history form, why are they on these supplements? Why are they doing these specific things? Why are they talking about the things that they've done to detox? You can find a lot of background information so you better understand your clients that are coming to you after their breast implant illness capsule removing of the implant, removing of the capsule. You can better understand what they're doing by reading this book, Strategic Holistic Accelerated Recovery Program, SHARP, by Dr. Whitfield. Thanks and have a great day.